Gastritis is a common digestive disorder that affects the lining of the stomach, resulting from inflammation. The causes of this inflammation can vary, such as diet, lifestyle, and environmental factors. In some cases, the inflammation can cause irritation, ulceration, and abdominal pain, as well as nausea and vomiting. For those who have gastritis, certain foods can trigger or worsen gastritis, and understanding which foods to avoid or reduce can help manage the condition and reduce symptoms. This video will show you 10 foods that are known to trigger gastritis. Before we continue with the list, make sure to subscribe to Healthy Lab and turn on the notification bell so you won't miss any of our new videos. Every subscriber is much appreciated. So, let's start. 10. Chocolate. Indulging in chocolate can be a delightful treat, yet it is one of the nourishments you ought to stay away from on the off chance that you have gastritis. Chocolate contains an assortment of compounds that can prompt issues for those with gastritis. It contains caffeine, which can augment the side effects of gastritis. Caffeine can raise stomach corrosive creation, causing more uneasiness and torment. Theobromine, found in cocoa, has a relieving impact on the stomach. This can bring about a loosening up of the stomach muscles and an expansion in corrosive creation, prompting more manifestations of gastritis. Chocolate additionally contains high levels of theobromine, which can disturb the stomach coating and exacerbate gastritis. It also has a high-fat substance, which can back off absorption, making it hard to retain fundamental supplements and putting extra strain on the stomach. Besides, chocolate is additionally high in sugar, which can cause an irregularity in the regular microorganisms in the gut. This can lead to an increase in bacteria that can cause gastritis. 9. Dairy products. People with gastritis may find dairy products problematic due to their high levels of lactose, a sugar that is difficult for the body to digest. This can lead to an increase in stomach acid production, resulting in irritation and inflammation of the stomach lining, causing painful symptoms such as burning, nausea, vomiting, and abdominal cramps. Furthermore, high-fat dairy products, such as cheese, cream, and ice cream, can worsen acid reflux, which occurs when acidic stomach contents travel up the esophagus and cause a burning sensation in the chest. Finally, dairy products can also contain a type of protein called casein. Casein is a type of protein that is difficult for the body to digest and can also cause an increase in stomach acid production. This can further irritate the stomach lining and make the symptoms of gastritis even more severe. 8. Garlic. The interesting fact about eating garlic is that it can be beneficial for overall health, but it may not be the best option for those with gastritis. Eating garlic can worsen their symptoms as it can irritate the stomach lining. This is because garlic has a high acidic content, which can irritate the lining, leading to heartburn, acid reflux, and stomach discomfort. Additionally, the strong smell and taste of garlic can aggravate the stomach discomfort associated with gastritis. Furthermore, garlic contains sulfides, which can be difficult to digest, thus leading to gas and bloating and causing abdominal pain. Garlic also contains allicin, which can have a laxative effect, leading to diarrhea, which can further irritate and inflame the stomach lining. 7. Carbonated drinks. Regrettably, many of the popular drinks on the market can be detrimental to people with gastritis. Carbonated drinks in particular are harmful since they feature carbon dioxide gas, which increases the acidity of the stomach's content, resulting in a burning sensation. This can make existing gastritis symptoms more intense and can even lead to ulcers in serious cases. Moreover, carbonated beverages often have a lot of sugar and artificial sweeteners, which can be a source of trouble for people with gastritis. When excessive sugar is consumed, it triggers the body to produce more stomach acid and causes further irritation for gastritis. Additionally, carbonated drinks are sources of caffeine, which can exacerbate gastritis symptoms. 6. Tomatoes. Tomatoes possess a naturally high acidity, which can be troublesome for those with gastritis. This acidity can irritate the stomach lining, which can be especially problematic for those with gastritis. The acidity can also decrease the effectiveness of certain medications used to treat gastritis, as well as increase the risk of side effects. Tomatoes are high in histamines, which are compounds that can trigger an inflammatory response in some people. This can lead to an increase in symptoms, such as abdominal pain, nausea, and vomiting. Therefore, those with gastritis should be aware of the histamine content in tomatoes and limit their consumption. Tomatoes are also high in fiber, which can be beneficial for most people. However, for those with gastritis, the fiber content of tomatoes can make them difficult to digest. It's best for those with gastritis to limit their consumption of tomatoes. 5. Fried foods. Eating fried foods can be particularly detrimental for those with gastritis. These foods are high in fat, which can be hard for the stomach to break down, potentially leading to an increase in stomach acid and an inflamed stomach lining resulting in pain, nausea, vomiting, and diarrhea. Fried foods are also high in sodium, increasing the risk of developing high blood pressure, a factor in stroke and heart disease. They contain saturated fats, which have been linked to an increased risk of type 2 diabetes and other conditions, as well as raised cholesterol. Eating too many fried foods may also cause indigestion, further worsening gastritis. Eating fried foods can be tempting, but it's important to remember that they can have serious consequences for people with gastritis. 4. Coffee. Drinking coffee may be detrimental for those with gastritis due to its high acidity, caffeine content, and tannins. The acidity of coffee can irritate the stomach lining and make symptoms worse, while caffeine can increase stomach acid production and worsen the burning sensation. Additionally, tannins present in coffee can further irritate the stomach, potentially leading to inflammation. Higher coffee consumption may result in more pronounced effects, as large amounts of caffeine can elevate stomach acid production and hinder nutrient absorption, such as iron and calcium. For those wishing to enjoy a cup of coffee in the morning, there are a few tips to keep in mind to reduce its impact on gastritis. Choosing decaffeinated varieties can help reduce the amount of caffeine entering the body, as can using coffee substitutes such as chicory root coffee. 3. Citrus fruits. Consuming citrus fruits may be advantageous or detrimental to one's health, depending on the individual's health situation. Those suffering from gastritis should be aware that the acidity of citrus fruits can be damaging to their condition. Citrus fruits are rich in citric acid, which can exacerbate symptoms of gastritis due to the compound psoralen, which is known to aggravate the already inflamed stomach lining and cause harm. Despite having high levels of vitamin C, which can be beneficial for overall health, it can heighten symptoms of inflammation for those with gastritis. Citrus fruits are often high in sugar, which can further aggravate gastritis symptoms, making the stomach produce more acid. Many citrus fruits contain substances that can weaken the stomach lining, allowing acid to pass through more easily. Overall, if you suffer from gastritis, it's best to stay away from citrus fruits. 2. Spicy foods. Spicy foods are a staple in many cultures, but for people suffering from gastritis, eating too much spicy food can be a recipe for disaster. When it comes to spicy foods, the capsaicin found in hot peppers is the primary culprit. This chemical compound is known to irritate the lining of the stomach and can lead to increased stomach acid production, which can exacerbate gastritis symptoms. Eating too much spicy food can also increase the risk of developing ulcers, which are painful sores in the lining of the stomach. In addition to worsening the symptoms of gastritis, eating spicy foods can also increase the risk of developing complications, such as ulcers and Helicobacter pylori infection. Eating spicy foods can also irritate the esophagus, which can lead to heartburn and acid reflux. Moreover, the high acid content of spicy foods can also damage the stomach lining, making it even more difficult for the body to heal. 1. Alcohol. Drinking alcohol is one of the biggest gastritis triggers. Consumption of alcohol can increase the production of stomach acid, resulting in further inflammation and damage to the stomach lining. Additionally, alcohol can reduce the effectiveness of medications used to treat gastritis, such as antibiotics and proton pump inhibitors. Drinking alcohol can increase the risk of developing gastroesophageal reflux disease, a condition that causes stomach acid to flow back up the esophagus and cause a burning sensation. Alcohol also can lead to dehydration and worsen symptoms of gastritis, as well as the risk of kidney stones. Drinking alcohol interferes with the absorption of essential nutrients, leading to deficiencies in certain vitamins and minerals. Overall, it is important to recognize that gastritis is a common digestive disorder that can have a significant impact on an individual's quality of life. It is important to understand which foods to avoid or reduce in order to properly manage the condition. Thank you for watching, and we look forward to seeing you in the next video.